Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
kind of addresses the kind of addresses some of the issues that we've been talking about for quite a while. But it's entitled Five Risk Factors at 50 Can Steal a Decade of Life. It points out that high blood pressure, high cholesterol, obesity, diabetes, and smoking can reduce your life expectancy by more than 10 years. This is a study that was presented by German researchers looking at those five factors. It's also published in our number one journal, New England Journal of Medicine. It's something that we've long expected and anticipated, but this is a study that participants were followed up to 47 years, and uh, it allows predictions up to the age of 90. Uh, the lifetime risks for cardiovascular disease, of course, we know is considerable, as are all the other five risk factors. And it rose, if you had those, for 24% for women and 38% for men. So, uh, and I think the real key issue is what do we do to uh, modify your lifestyle to lower your blood pressure? I think one of the biggest concerns I've recognized is that with all of our knowledge about cardiovascular disease, the rate of death from cardiovascular disease hasn't changed. And one of the biggest problems is that most people who have high blood pressure don't take their blood pressure medicine regularly. And if you don't really lower your blood pressure, then the impact of cardiovascular disease is going to continue. And so, uh, one of the most important things that we could do is to take our blood pressure medicines and make sure that our blood pressure is lowered to normal levels. And nowadays, we think that the blood pressure level should be around 120 over 80 or lower, although we have different ideas about what is considered hypertension. And but most of the studies will say that if you keep your blood pressure at 120 over 80 or lower, that the complications of cardiovascular disease are accounted for. But that is not the case. The fact that when we do our screens and we do screens on a weekly basis, just about most of the patients who have hypertension are people who know they have hypertension, but they don't take their medications.
Mm.
And so an ounce of prevention is worth a pound of cure. But if you find out you have hypertension, then the treatment of it becomes very critical, just as the treating of obesity, the treating of keeping your diabetes and hemoglobin A1C around 6 or 7, uh, lowering your cholesterol level, and addressing being overweight are aspects that are important in order to live as long as you can. And nobody wants to live forever because the quality of life as we age becomes less and less. And so uh, the healthier you are, the healthier lifestyle you have, the less likely you are to have quality issues as you age. But the smoking, overweight, diabetes, hypertension, and cholesterol are the big uh, factors that cause us to have many diseases as we age. Any comments or questions about this? Something that we have discussed a lot, but the floor is open for any comments that you may have relative to this article, which is very timely and appropriate.
I have a quick question, Doc. Do you know if the men are the more uh, resistant to taking the blood pressure medication compared to women?
Well, since I don't know the answer to that question because I found a lot of women who are doing the same thing. And I don't know a study that looks at both men and women and factors in to allow me to answer that question. So I don't really know. Uh, but I know in our screening, we found, well, of course, here's the problem. For the screening, most of the people we screen are women. Uh, so oh, a lot of the men don't even get screened. So that kind of
Mhm.
answers your question. That most of the data we have is about women, and that the men are absent most of the time. So
So the screening process, is that based on just going to see your physician normally, or
the screening process is we have
Right.
clinics in which we, at no cost, give people the opportunity to get their blood pressure checked and their urine checked to see if they have protein in the urine and to see if their blood pressure is normal or not. So it's no cost and it's voluntarily done.
All right.
Any other comments or questions about this great article? Okay, let's move to the next one then. This is interesting to see how AI is helping us to detect even liver disease with cardiovascular screenings. And this is an algorithm that helps cardiologists identify liver disease from uh, uh, using images from the standard the echocardiogram. This is amazing that they could do that, but this kind of was unexpected finding that actually from cardiovascular screenings you can identify liver pathology. This is a new study that they used more than 1.5 million videos, 25,000 patients, and they were able to identify cirrhosis and steatotic liver disease just by looking at the videos, which is shocking to me. But I think this is good because this is another way of detecting liver disease, which now can be treated with some of the GLP-1 drugs. Before then, we didn't have a good way other than to say to reduce your weight uh, and treat your diabetes, get your hemoglobin A1C at 7 or below. And so this algorithm uses an echocardiogram and may look at different areas of the chest and from the subcostal view, they look at the liver, and the liver uh, uh, with AI is able to identify cirrhosis and steatosis, which is an interesting way of doing it, which is a little different. Uh, we know about the ultrasound being used to diagnose liver disease and fibrosis, but using the echocardiogram is a new way to do this. So now this has not been applied generally. It's just something that researchers identified as another way of identifying the fact that your liver may need some treatment. Whether this will be able to help us uh, treat the MASLD, which is the metabolic liver disease that leads to cirrhosis and liver cancer and requires transplantation. And hopefully an earlier diagnosis of this will, since we now have treatment for it, may help us uh, prevent uh, far advanced liver disease and cancer. Anyway, this is another way in which artificial intelligence may be able to help science and medicine as we move along. Let's go to the next article then.
I had a question, Doc.
Oh, sure, sure. Go ahead.
The difference between cirrhosis and steatosis.
Okay, cirrhosis is the end stage of liver disease. When you have cirrhosis, that means you have fibrosis of the liver, and in many ways, the liver is dying or dead. Whereas the metabolic situation is the pre-stage of the liver disease that, if caught early, can be treated now with some of the GLP-1 diseases and with correction of the diabetes and obesity.
Okay, thank you.
Good. Any other comments or questions? If not, we'll go to the next article. This is we've talked a lot about obesity recently, and talking about BMI and the fact that if your BMI is between 25 and 30, you're overweight. If you're over 30, you're obese. But this article says that beyond knowing whether you have a BMI that's overweight or obese, is that you need to lose weight and be in an ideal weight. And if you're not there, you should move towards it. And so that whether you get your BMI where you want it to be, you should at least lose weight, and that will make you healthier. And this talks about how improvements in overall health uh, occur whenever you start losing weight. And so whatever you can do to get yourself closer to your normal weight is good for you because it improves your overall health, improves your blood pressure, improves your uh, hemoglobin A1C, your triglyceride levels, and all of this is good for you. It improves all conditions, obstructive sleep apnea, cardiovascular disease, so that they're just saying that just losing weight alone is good for your health, whether you get down to your goal or not. It's something that they feel is underemphasized and underappreciated, the importance of trying to get closer to a normal weight. We remember uh, how often we've talked about losing weight, but this is a situation in which the weight loss goal, the idea of it is healthy. Whether or not you get to the BMI that you desire or not, first step is to lose weight and take steps towards improving your health by losing weight. Any comments or questions about this uh, article that emphasizes more about getting closer to the ideal weight than actually achieving it itself? We have some more articles that will talk a little bit more about that. Any comments or questions?
I do. I can't seem to get my screen straight to raise my hand, and you might have already have said fatty liver. What exactly is that?
That what happens with is that the fat replaces the normal liver cells, and as a consequence, that then destroys the liver, and you wind up with cirrhosis, which is the end stage liver disease. And when we talk of metabolic liver disease, we're talking about steatosis. When we say steatosis, that's fatty liver disease, in which the fat is replacing the normal liver cells. And as a consequence, the end result of that is that you wind up with cirrhosis or end-stage liver disease. So that's what fatty liver disease. It is more associated with diabetes and patients who are overweight. The good news is that we now have uh, a treatment for it, which we didn't have before.
A few years ago, I had a physical, and the doctor said I had fatty liver. Oh, don't worry about it. And since then, and it's been a couple of years, 3, 4 years, since then, it's never come up. Um, it doesn't go away, does it? I mean, is it something that I should look into?
Yes, it does go away, and
Oh,
that's why it's
okay.
important if you have it that you control your blood sugar, get your BMI is as close to normal as possible, because the treatment is to lose weight to get your diabetes under control, and if necessary, if for example they do tests that confirm that you do have fatty liver disease, that it should be treated. But the fact that they have not said anything to you about it suggests that maybe have they looked for it since then, or have
No,
you had any comment about it?
no discussion regarding it at all.
Yeah. So
But maybe I
apparently,
should bring it up.
yeah, ask them what do they still think you have any evidence of fatty liver disease, or is it gone? You could ask them that, because
Okay.
we now have a way of treating fatty liver disease, which we didn't have before.
Okay. Got another question. What is primary sclerosing cholangitis? What type of liver disease is that, or the causes?
That is an idiopathic disease in which the bile ducts have
Mhm.
become hard. And the bile ducts are the ducts that take the stuff that the liver produces and sends it throughout the rest of the body. And it is uh, a pre-disease to liver cancer. And
Mhm.
we don't know what causes it, but we do know that it causes liver cirrhosis, and it also causes cancer.
Okay.
So, uh,
It-
but we don't know what causes it, but we do know that when it occurs, the end result is the liver dies. And you're going to need a liver transplant for it.
'Cause, that's what my husband had. And
Oh, I know. Yeah.
yeah,
And
and many years ago, when it first came about, they said it was rather rare. And who was the football player? Walter Payton had it. And soon after diagnosis, I believe he passed. Um,
right,
David, of course, was checked with it constantly as far as cancer, and it wasn't cancer wasn't the end result of that for
right,
him.
right,
Yeah,
right. Dr. Scott uh, talked about him a lot in terms of following the idiom that,
exactly.
yeah.
Yeah, hmm
So he had a good result from it.
he
It was,
did. Yeah,
yeah.
everything involving the liver that he fought with over the years, that wasn't what took him away. So you
Right.
never know. Yeah,
Yeah.
we all thought it was the liver, but it ended up being something else. Mhm.
Yeah.
Yeah.
John Buchanan, you have a question?
Yes, Dr. Callender, what um when you get your annual blood work done, do you have to request the A1C? Because I don't see it on my blood.
Well, if your blood sugar is less than 100, most people don't bother with it. If it's 100 or less, they don't bother with it. If it's over 100, then you might get a hemoglobin A1C. But if it's 100 or less, most of the doctors won't bother with it.
Which test would show that it's 100 or less?
Blood sugar,
Blood sugar,
glucose,
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 glucose.
glucose,
Okay, thank you.
blood glucose. Yeah, and uh, but that's the common look. Is if the blood sugar is 100 or less, they tend not to do hemoglobin A1C, because that means you're okay. On the other hand, if your blood sugar is over 100, then they're gonna, because the absolute best test is the hemoglobin A1C, but you probably don't need it if your blood sugar is less than 100. Dolores, you had the question or comment? No? Okay. All right. Any other comments or questions about this? If not, we'll go to the next article. The discussion about weight loss surgery versus GLP-1s. Uh, which is best, or are they both good? And this is a good article that talks about the good aspects of both and concludes that the real issue is something that John asks all the time: is what is the cost? And as they looked at these both of these entities, both are effective. But it turns out that surgery is the most cost effective. Uh, of course, one of the issues that still has not been determined, how about 10 years later? We know about the short-term impact of GLP-1s, but we don't know about the long-term impact. We do know about the long-term impact of bariatric surgery. And so as they looked at all of this, and they looked at the cost of bariatric surgery for a year and the cost of GLP-1 use for a year, and they said that based upon the costs, the bariatric surgery is the most cost effective, but they both are of merit. Um, and they talk about the high cost of the GLP-1s, although here the reason why it's so costly is because GLP-1 drugs are not approved for anything other than diabetes. They're not approved for obesity. I remember last week we had an article that complained because it was not considered a treatment for obesity. And as such, therefore, the cost of the medication remains higher than is desirable. But the bottom line is that both of these entities, the GLP-1s and the bariatric surgery, are effective at losing weight. But on the short term, talking about 2 years or so, uh, the bariatric surgery is more cost effective because most of the commercial companies cover bariatric surgery, but they don't cover GLP-1 drugs for obesity. Any comments or questions about this very important paper, which uh, addresses the treatment of diabetes, now of obesity? Now, if you're obese and you're diabetic, then you can take the GLP-1 drug for your diabetes and treat your obesity at the same time. Any comments or questions about this? Because this is an interesting article, but the other aspect of the GLP-1 drugs is how long do you take them? After 2 years, are you still taking them? Most people are not. And so that's another question. Is it safe to take them for longer than 2 years? And should patients continue to take it after 2 years? That's the question. And if after 2 years and you stop taking the medication, was the weight come back? And those are the questions that still remain to be asked and answered. Any other questions about the role of bariatric surgery and the GLP-1 drugs in the management of obesity and diabetes? Okay, well, let's go to the next article. And this is a new drug by Lilly that doesn't say much about the cost of it, but it does say that it works as well as the GLP-1 drugs. And so this is another drug that you see the name up there. Of course, I never heard of it before. Uh, and so time will tell as this drug becomes available and it competes with the GLP-1 drugs, whether this will be as expensive or as effective in the long run as the GLP-1 drugs. Well, we know that GLP-1 drugs affect more than just obesity and diabetes. We don't know whether this drug is that effective against the other disease entities. You remember the article we talked about last week that identified 6 or 7 organ systems in which GLP-1 drugs were effective. Any comments about this new development? No comments or questions?
One thing I think, did they mention that this is a pill rather than an injection?
They didn't say. They didn't say, and that's let me see. It just said treatment. It didn't say uh this is a pill. I guess that's what's different. This is a pill. The other drugs are injections. That might make it more attractive to people who don't like to stick themselves.
Right. That's what I was thinking.
You know, all of the commercials you see the patients sticking themselves. So this is a pill, and that might make it more attractive after it becomes available. What do you think? You think that if it was a pill rather than injection, you would consider it more if it's less expensive or not? What do you think?
Yeah, I think so. And now
Mhm.
Pfizer's coming up with a pill too
Yeah. So
to compete with Lilly.
yeah, yeah. Competition is good for us in the long run. It makes things cheaper. Let's go to the next article if there's no comments or questions. This is a great article about sometimes people who are obese and they have shortness of breath or other conditions. They try to blame it all on obesity, when in point of fact, it may be other factors. And this is an article that talks about the doctor who had a lady who was obese and was getting short of breath and couldn't get around. And uh, she thought everything was due to her weight or her being obese. In point of fact, she had coronary artery disease. And after she had the coronary artery disease treated by stents, she was better. So the article is all about saying don't try to blame everything, every symptom that people have who are overweight on obesity, because it may be other factors, and that they should be treated like anybody else. They have a disease entity which is obese, which is an inflammatory disease, but they also are capable of having other diseases as well. And so don't try to blame everything on the obesity, but try to be sure that you've eliminated other factors as causes of shortness of breath and other problems. And don't put it all on just obesity. I think it's important because having that bias about obesity uh, might uh, leave you taking care of, keep you from taking care of a disease that is treatable. And I think it's appropriate for her to bring that up. And I think this is a good article that uh, if you have new symptoms and you are not have not gained any more weight, then you should take a look and find out to make sure that it's not obesity, but whatever could possibly be causing the pain or the aches or the shortness of breath. Any comments or questions about this? Do you think that our concern about obesity is exaggerated, or what are your thoughts about the talk we have about obesity, since 50% of our nation is afflicted with obesity? What are your thoughts about it? Any comments or question about it?
I, I think it's important. I think overweight is important. Years ago, I don't think it was much of an issue. More recently, We do tend to eat a lot of fast food and junk and grease, and that puts on the weight. The additional weight oftentimes cause more health problems. And more recently, recent years, some of us are not as active as we once were. A lot of the articles, even this morning, you say this every week, especially for seniors: be active, walk, watch your weight. So I think it's very important.
Darryl?
Yeah, good morning, everybody. Let's see. I think I remember reading that 42% of adult Americans are obese, and it's more of a critical concern for Black Americans
Mhm.
because we're 49% of adult Black Americans obese, and that breaks out to 59% of adult Black women obese and 41% of adult Black men obese.
Thanks for sharing. Thanks for sharing. Uh, Sometimes we don't appreciate the importance of those data items that you shared. Thank you so much. Any other comments or questions? Let's go to the next article. One of the things about the fact that we have so much uh, uh, obesity is the fact that this also leads to kidney disease. And uh, when you look at if you 50 or above, people of color have more, as you age, you get more kidney disease. And so it becomes more important for you to get your urine protein checked when you get your annual physical to see if you have early signs of kidney disease, because the proteinuria is one of the earliest signs of kidney disease. And the sooner you pick it up, the sooner we can do something about it. This is an article that talks about cardiovascular health and talks about your sleeping and waking up, and kind of suggests that people who work at night and don't and eat at night don't do as well as people who work during the daytime and sleep at night. And so they say that aligning meals with the body clock could ease heart risks. This is a theoretical article and tracked healthy men and women and identified that those people who ate a lot at night didn't do as well as those people, and they did studies on heart rate differences, and they had different electronic devices that could clue their body clocks to the real time. And they found out that those who uh, ate different hours when the body was used to be sleeping, that they didn't fare as well. And this is interesting because they're people who work at night, and uh, this particularly affects their circadian system, with the end result that the anticipation is that cardiovascular system is going to be uh, affected in a negative fashion because of the fact that the body expects that at night you sleep and in the daytime you wake, and you need calories in the daytime and don't need them at night. And this circadian rhythm, when it's interrupted with food timing, uh, can destroy the cardiovascular health. Yeah. Any of you work at night? I know Darryl does a lot of his work. You're singing at night, don't you?
Yes, sir, I am. And what I try to avoid is when I come home late at night, well, when I come home early in the morning, I try to avoid eating when I come in. So I try to get a meal before I head out for a gig.
Mm. Anybody else have night working?
Yeah, I have the similar situation when I gig. Fortunately, uh, it's not that often, but maybe a couple times a month. Uh, I'll get in at 2 or 3 in the morning, um, and I try not to eat anything heavy, even at the gig itself. I try to eat before going to work. So, but I play in a lot of clubs where they serve food. Chicken and fish and all kind of French fries, shrimp, all that stuff at night. I'm talking about, 10, 11, 12
Yeah.
o'clock at night. And I'm pretty sure that's not very good for your diet, for your body.
Yeah.
Okay,
There'll
well,
be there'll be times where I have to head out earlier than normal dinner time for a setup. Like I may have to head out at 4 o'clock, and if so, I generally take food with me that I can eat on a break.
Mhm.
Idea.
any other comments? Not interesting article. Okay, let's go to the next article. Burping is not something that a lot of us talk about. Uh, some people think burping is a way of identifying the fact that you've had a good meal. But we do know that it is associated with reflux, uh, and it can become a medical problem. And this article just talks about the many ways of treating it, medical, surgical, and other ways. Of course, one of the things that you keep in mind is that indigestion is sometimes one of the ways that you manifest a heart attack. And so when you have indigestion, don't always think that it's only indigestion, but it could be a signal that you have heart attack or coronary artery disease. But if you have been examined and it turns out to be just burping, then there are a number of ways of addressing it. Any of you ever have? I know hiccuping is something that is uncommon but occurs. Burping is something that is less common, but it's still something a disabling condition if you have it. Any of you have any of those conditions? Um, Janice?
Yes, my sister is going through this now, and she had an episode a month or so ago. I took her to patient first. You're okay. They thought it was acid reflux, and they gave her some medication. 2, 3 days later, I had to take her to the hospital and acid reflux, and they did think it might have been something wrong with the heart as well. She wore a monitor. They said she's okay, but now she's scheduled for a endoscopy, and
Yeah.
she's supposed to have that on Monday, and she's still doing the burping. I
Right.
don't know if that's a good thing or a bad thing.
Well, I think that as this article shows that there's a way of treating it. As you see identified, there's two or three different procedures that they've done in order to try to address the burping. Endovascular, as your sister's or relatives having,
Mhm.
as well as other electronic conditions that they use to deal with burping. So if you have it, it's not fun at all, and it does require interventions. And
Correct.
down here it talks about even Botox being injected into the esophagus, which it seems to be very effective, and then two other additional procedures that are done. So it's something that when it occurs to you, it's disabling. And I'm happy that she is getting treatment for it. John Buchanan, you had a question.
Yeah, it's three, in fact. So I've heard that certain cultures, um, after you eat a meal, say your host gives you a meal, uh, I've heard it was a sign of respect and appreciation
Right.
when you can come up with a real good burp, right?
That's true. Yeah, there's a movie. Oh, Ben-Hur.
Okay.
They talk about that, yeah. And if you
Okay.
don't burp, that means you didn't like your food.
Right, right. So
Yeah.
the other thing, when I was hospitalized earlier in the month with severe GERD, acid reflux, and I couldn't burp and couldn't swallow either. And I had an endoscopy. They didn't discover the real cause of it, and but then the third thing that I just saw, I think up at the top, they mentioned gurgling, and I'm wondering what that is because every now and then I'll hear something in my chest that sounds like gurgling, uh, and I can't, I can't identify what it is, but it's loud enough that somebody on the outside could hear it. What do you think?
Well, it just sounds like your gastrointestinal tract, whether it's your stomach or your colon. But gurgling does indicate that the intestinal contents are moving around. That's what the gurgling is all about. The question is whether it's your stomach or your colon, the transverse colon, which is up there. Uh, and Darryl, you had a comment or question?
Yeah, in case anybody's wondering what foods cause the most burping, top of the list would be beans, cruciferous vegetables like broccoli, cauliflower, Brussels sprouts, dairy products, and carbonated beverages. Some people bringing up the rear. Uh, no, that's the other end. But people bringing up the front for burping could be things that you don't think about, like spicy foods and chewing gum.
Thank you for sharing. Okay, any other comments or questions?
Can't get my hand up quick enough. I'm sorry. One of the things he mentioned, carbonated beverages. Well, when the burping starts, when she feels she needs to burp, she'll grab for that ginger ale or Coke something to make her burp. So I don't know if it's an oxymoron or not, but you're saying the carbonated beverages will cause burping. Um,
Yeah.
I don't know.
Well,
I guess we'll find out Monday when she has that test. What's going
yeah,
on?
that apparently the single Botox injection is enough for 80% of the cases, but
Okay.
um,
Mm.
it's amazing. It's amazing when you're using Botox for so many different things now
Mhm.
to keep your face young, and now using it for uh,
Yeah.
the esophagus, and
Mhm.
there's no limit to many ways in which this treatment can be helpful. Any other comments or questions? John John Buchanan, did you have any more questions about that?
No, I'm gonna have to check on that gurgling though.
Oh, of all the symptoms you've had, the gurgling is probably one that is the least worrisome. Okay, let's go to the next one then. How everyday food additives may be fueling type 2 diabetes. It's interesting because now we know that the Secretary of Health is going to be doing away with food dyes, which is a good thing. And this article talks about the many different ways in which we add things to our food to make it more attractive. And what we're doing is uh, exposing our bodies to additives that are unnecessary and maybe toxic. And this article talks about the different types of additives that is making things bad for us. And this is identifies five main food mixtures in which they add things to our food to make us want it more. And sweetening beverages, desserts, broths, fats, and sauces, all of that. And we know all about the artificially sweetened beverages and how they relate to type 2 diabetes. And so in many ways, the good of Kennedy is that he's going to try to eliminate most of these additives that are not healthy as soon as possible. And it's amazing how many things are put in our foods that are really not supportive of improving our health, but are supportive of getting us to be more eating things that really are not any good for us. And this then is something that will be good about the role of Kennedy as Secretary of Health in terms of trying to eliminate some of these additives. Any comments? Because this is something that is going to be discussed for quite a while, because I think his position on this emphasizes the fact that these additives aren't improving our health, but are likely worsening our health. And so this will turn out to be a good thing in the long run. Any comments about the additives and the way in which our health could be improved by eliminating some of these additives? No comment? Surprise. Okay. All right. Let's go to the next article. Now, this is an article that challenges the report that sugar sweeteners are problematic. And all it really is saying is that most of the studies that have been done have not been given sugar substitutes a fair shake. And they're not saying that the non-sugar sweeteners are bad for you per se. They're just saying that the data that has been used to give them a bad name is problematic, and that we need to have more accurate studies that look at it for the short and long term, and have randomized control studies that will give us a better answer. So, and they say that most of the studies were short, and that's why the World Health Guidelines suggest that sugar substitutes were not as beneficial. And this article says that the studies that we have that gave us those conclusions should be looked at again, and it should be recognized that they're very short-term studies, and they really are not of good quality. But anyway, it's food for thought. If you're a diabetic and you can't take glucose, then sugar substitute will help you with control of glucose, but will introduce to you a different variable. And it's just to note that the jury is not out yet on how problematic sugar substitutes are, in particularly in those people who are diabetics who cannot tolerate glucose. Any comments or questions about this article and its conclusions? It's not saying that processed foods are good for you. Definitely not. But it is saying that sugar substitutes need to have more data and more randomized controlled studies. And they're suggesting that a lot of the studies dealt with processed foods in addition to the sugar substitutes. Any comments? If not, food for thought, and we'll see over time. Darryl?
Yeah, these studies on sugar substitutes, wouldn't they come out of mostly the Department of Health?
it seems like a lot of these studies they're talking about came out of London and the UK, and I didn't see a lot of them that came out of the United States.
Okay. But they could potentially come out of uh, different government agencies associated with the Department of Health.
Yeah, that's right. Yeah,
Yeah.
yeah.
And the reason I bring that up is because they've laid off a lot of the research staff for the Department of Health.
True.
You're right. You're right. It's interesting how that's going to affect us in the short term and the long term. I saw an article in the newspaper that they were talking about they couldn't continue to do studies on some of the foods that they were releasing because they don't have staff to do it because the staff have been fired. So it's going to be interesting how all of this is going to play out in the long run. Our quest to save dollars may wind up with us losing lives. And it probably has already cost us lives, suicides and other things that have occurred because of some of the changes occurring. Any other comments? If not, let's move on to the next article. Somebody asked a week ago or so, I think it was Buchanan, about the if you get a CAT scan, does that increase your risk for cancer? And we deliberately said, well, if you only get one CAT scan, but how about those people who have to have more than one CAT scan, have to have many procedures? And this study says that those people will have an increased incidence of cancer, although uh, uh, it's not an alarming figure, but any figure that shows that more CAT scans you get gives you an increased incidence of cancer is something to be worried about. And so what the article is saying is, as we know, the people who developed radiation died from radiation. And so radiation used willy-nilly will expose you to increased incidence of cancer. And so if you're going to get a CAT scan once, that's one thing. But if you're going to get a number of CAT scans and a number of x-rays, then that is going to increase your likelihood of getting cancer, whether it's lung cancer, colon cancer, leukemia, bladder cancer, or thyroid, lung, or breast cancer. That there is a risk associated with when you get a lot of CAT scans. There is a risk of the radiation causing cancer. So this is one of the few articles that or even dental x-rays, yes, that increases. But that's why whenever you get dental x-rays, you're supposed to have the body's shielded. Uh, so um,
That's all the body except for your head.
you're right. Yeah, well, that's why. Uh, and I guess the question is, how often do you get dental exams? Darryl, you had a comment.
Yeah, I was just looking at alternatives for CAT scans, and they say MRIs, ultrasound, and EOS imaging. And they also say
Yes,
that MRIs
thank
are
you.
safer
Yes,
than CAT scans. So
yes.
if a doctor orders a CAT scan, should you ask if MRI is a better alternative, even though it's more expensive? And then do you have to fight with the insurance company to get them to pay for the MRI since it's more expensive?
Well, you said it. You said it. And so if you're going to have to get a number of them, then yeah, I think you might, that's a discussion that's good for you to have with your physician. Yeah, because sometimes the physician isn't as sensitive to it as we should be. And it's your life and it's you're the one who has the potential of being exposed to the radiation, which can increase your risk for cancer. So it's something we should be more aware of, and I think, yeah, your point is well taken, Darryl. Let's go to the next one, next article. This is an article that, we now have epinephrine nasal spray, and it's good with or without allergic rhinitis. Some people would say if you have allergic rhinitis, it may be a problem, but this article is saying with or without allergic rhinitis that and the treatment of anaphylaxis with the nasal spray is good. Of course, as we know, anaphylaxis kills. And so you need treatment as soon as possible in order to keep you alive. And if it's nasal, fine. Uh, some people are afraid of needles, and that's why they would prefer the nasal spray. But when you're in that kind of situation, uh, whatever gets you the treatment the fastest, that's the best. Anybody have occasion to use the new nasal spray that as treatment for anaphylaxis rather than the injection? Not yet, and may you never have to. Okay, good old EpiPen is still good, but it's still expensive too. And I'm surprised John didn't ask how much the EpiPen, I mean how much the nasal spray costs.
Doc,
I don't
how
know.
much does it cost?
It's expensive.
None of the articles ever talk about its cost.
So
Uh,
how much is the EpiPen?
oh, I don't. Any of you buy it? Uh, I know it was expensive. I heard somebody says about $25 or something like that. I don't know. Any of you purchase it? I guess Janice, does Chris
Yes,
have
he carries one with them. He has to. Um, Military, they pay for it.
Oh,
Got
okay.
it in military. He got the disease or whatever it is during his military service, and they pay for his medications.
I see. Okay.
Yeah.
So I don't know the answer. Darryl.
Yeah, you get a package of EpiPens with 2 auto injectors for roughly $650.
Whoa. Woo. Yeah. Mhm.
Wow.
Yeah.
That's costly. But
Mhm.
it's cheap in terms of saving your life, but
Yeah. Mhm.
$150 is a lot of money. Yeah. Well, thanks, Darryl.
So I'm thinking that most of the insurance covers the EpiPen. Most people don't have to buy it off the counter, right?
I don't know. I guess the allergic population is probably the group that is more likely to buy it than, if you're not allergic to anything, you probably don't even think of it. Whereas if you have allergies, then you think about it. And I don't know the answer to the question whether the insurance covers it or not. Darryl?
Okay, I just did a search on how much does the Epi nasal spray cost, and the average cash price without health insurance is $125 per bottle.
That's not bad.
Mhm.
That's probably more than a few sprays per bottle.
Yeah. Well, okay. Go to the next one. I don't know if anybody has migraine, but it's one of the most disturbing headaches you can ever have, and it lasts a long time as well. And this study says that much of the increased risk for migraine is related to people who have allergic diseases such as asthma, atopic dermatitis, allergic rhinitis, and allergic conjunctivitis. And uh, I'm not, I don't know how many people have migraine.
He has
Um,
that too. Chris does. And
Krista has that.
periodically, when he gets the migraine, oftentimes it means going into the hospital. It depends on his situation, what's going on. I want to say women, but whatever. And seriously. And but
Um,
it's been about a year now since he's had to go to the hospital for it. And when he goes, he gets some sort of IV and has to stay there for several hours. That's how bad the migraine gets.
wow.
But his life now is calmer. Nobody's in his head, and he's doing well. Dr. Callender, he had a house built, and he might be moving soon.
Hmm.
He's doing okay.
Okay. Darryl?
Janice, does Chris have allergic rhinitis?
I don't know about that one. I don't think
S-
so.
s-
No.
Sinuses. Does he sneeze a lot?
No.
Right? No, it doesn't. Okay.
No.
You
Yeah.
got everything
I
else?
just mentioned that because that could be one of the triggers for migraines.
Yeah, no. I think really the migraines come on with stress. Keep the stress out of your life. I tell them you'll be fine. And like I said, it's been a while. At one point, it was frequent. Every couple of months or so, it would get bad, and he'll try to take the medication and lay down. But seriously, it would get so bad he'd have to go to the hospital. And but he's fine now.
Okay. Let's go to the next article. This is I don't know if anybody's had tic Row, but that's one of the most another one of those painful conditions of the jaw, and apparently intravenous uh, of this Callender type drug is effective at treating this kind of situation. I don't know if anybody's ever had the tic Row, but it's acute trigeminal nerve pain that is kind of as bad as migraine. And if you have it, you really have to go to the hospital to get it treated. And so they now have a medication that given intravenously, which is able to control it. In the past, it was one of the procedures that one of the conditions that required almost surgical treatment to take care of it. But now we have a medication that is effective.
Doc, what was the condition you mentioned? I couldn't understand what you were saying.
Well, acute trigeminal neuralgia, which is a painful condition in the jaw that hurts so bad that you have to go to the hospital to get it treated. And they have a new drug that now is effective. It's a drug that's used to prevent convulsions, but it also is effective of taking care of the pain from trigeminal neuralgia, which is the term that they use in this article.
But didn't you mention a common name for it?
Tic Row is the
That,
term that
yeah,
used to use.
I've never heard of that. Say that again.
Tic Row.
Oh, okay.
It's a term that we used to use for trigeminal neuralgia, which means that the trigeminal nerve is the cause of the problem, and you have that pain. You have to go to the hospital and get a nerve injection or a special treatment. Otherwise, and now we're finding that this new medication, which is an convulsant, will actually take care of the pain. And when they talk about pain that's at the top of the ladder, they talk about uh, kidney stones, uh, having babies, and tic Row was in that category as well. Trigeminal neuralgia was in that category as well. Rapid effective treatment now exists. So that's Janice.
How does that compare to lockjaw, or is that related? Lockjaw.
Lockjaw is kind of different in the sense that I think that's more. I think that's more of a dental problem, but I'll have to look up lockjaw because I'm not exactly sure what they meant by lockjaw. So I have to look that up, find out.
Okay. All right.
I thought lockjaw was more like trismus, where the muscles were spastic
Hmm.
and you couldn't open your mouth.
Yeah. Hmm.
That's what was my thought about lock,
Yes. Okay.
but I will look it up to double
Hmm.
check. But that's my Darryl.
Yeah, AI overview, lockjaw, also known as tetanus. It's a serious bacterial disease that can cause severe muscle spasms and rigidity, particularly in the jaw.
Okay.
Thank you. Thank you.
Thank you. Thank you.
Good. Well, this is just an article that talks about social media and talking about cortical testing when they think that for the most part it's overemphasized and exaggerated, and it could get people to get cortisol levels when it's probably not necessary. Uh, Cortical tests look out for Cushing syndrome and adrenal insufficiency, but most people don't need that. And if you have chronic fatigue and other things, uh, then you may have a need for it. But for the most part, getting cortisol levels without any symptoms is not appropriate. But if you are very chronic fatigue and your doctor feels that is necessary, then fine. But uh, just because you have some fatigue is not a reason for you to get cortisol testing, unless you go to your doctor and your doctor evaluates you and doesn't find a medical reason for your fatigue. Because fatigue has many causes, and so it does require a thorough evaluation. Uh, but simple cortisol testing is not usually the answer for fatigue. And I guess the real essence is to not use the social media as your doctor. That's what the real issue is. The adrenal glands uh, play a great role in terms of producing cortisol, and cortisol is what is produced when you need it for any kind of condition that causes alarm. But uh, but when you have insufficiency, it causes problems. When you have excess production, it causes problems. But in general, if you're just fatigued, that is not an indication necessarily alone to get cortisol levels just because social media says so. It's amazing the impact of social media has on so many facets of life. And since social media's its accuracy and truth value is not addressed, uh, the perils of paying too much attention to social media is something that is avoidable or should be avoided. Any comments on this article? We've talked about GLP-1As and the fact that they are associated with muscle loss and how resistance training plus protein intake will eliminate that as an obstacle. That is probably thought to be one of the most common side effects of the GLP-1 drugs, as the osteo, the uh, oste- I guess what you call a reduction in the muscle mass because of the fact that they're not eating properly. And as a consequence, they uh, lose protein, and uh, the treatment is to eat a regular, appropriate diet and do resistance exercises to keep your muscles growing. And there are many studies that have demonstrated in patients with GPL1s that the muscle mass loss was significant. Uh, and one of the things to do is to be sure that you continue your resistance exercises and eating properly. Uh, because when you take the GLP-1s, you reduce your appetite, you lose fat, but you also lose muscle. And weight resistance increases in muscles, and eating correctly will prevent you from losing the muscle mass that is traditionally lost with the GLP-1s.
Mm.
Comments, questions?
Um, I don't know how to use this thing.
Oh, Dolores,
Yes.
you had a question or?
Yes, I was wondering, um, I'm a walker in the morning, and the other day my thighs started hurting, just my thighs. And I was just wondering what could cause that.
The thighs don't, this before or after you exercise?
During my exercise.
During exercise. How far did you walk?
Um, so I'm used to going around the track 4 times. I could barely make it around one time. Had to keep stopping to hold my thighs.
Oh, so it was hurting, huh?
Yeah, it
Hmm.
wasn't painful, but it was uncomfortable. I didn't like walking like that.
Yeah, that's that. I don't know why that happened to you. Have you been doing it every day, or how often have you been doing it?
Um, I've been walking Monday through Friday. This star happened yesterday. So today I didn't walk because I figured maybe thighs need to take a break. But I don't know.
I don't know that.
Strange.
I don't know I don't know the answer, but I think that so you took off one day, huh?
Yes, today.
Yeah, so I'm interested to see what happens tomorrow, because that is unusual. But it suggests, but it does suggest uh, that your muscles are tired. Uh, but I don't know
Mm.
why. I can't answer why. Did you did you have any spasm, or did they tighten up, or just felt uncomfortable?
Just felt uncomfortable.
Yeah, well, you did the right thing. You stopped and uh, try it again tomorrow and see what happens. You walked around the track four times, you said,
Yes, that's two
General?
miles.
Yeah, that's good. Good walk. Wow.
Mm.
I'm sorry, I can't help you. I wish I could examine your thighs and see. Would you have no other manifestation of it, just only when you try to walk. Your regular walking, is that affected by it?
No.
Oh, okay. Well, maybe it's just a one-time thing. Let's maybe try it tomorrow and see what happens. I wish I
Okay.
could be more help to you. Sorry.
Oh, just wonder if anybody had that happen to them.
Well, walking is so good for you, and don't want you to stop, but maybe slow down to maybe once or twice, and then build back up to where you were before. But any other thoughts by anybody else on the panel?
Yeah, hydration. Sometimes that causes issues like that. Hydration. You have to
Hmm.
drink a lot of water.
But I'm on dialysis. I can't drink a lot of water.
Oh, you're a renal patient. Oh, okay. You're right. You can't. Right. So, so what, and also when you go for your dialysis, talk to your nephrologist and ask him about it as well.
Yeah, I plan to tomorrow.
Okay. Good. Good. Okay. Thanks for sharing, though. Thanks for sharing. Okay. Next article, please. This is interesting that it follows our conversation. Longevity in exercise. Moderate wins, more isn't better. Suggesting that uh, the more you exercise isn't necessarily mean that you're going to live longer, but moderation in exercise is what they're suggesting. They This is an article that it doesn't have a whole lot of data. It talks about 22,750 twins that they did data on. And they concluded after they got the data that physical activity uh, was no mortality guarantee when you went over the 75 to 150 minutes of exercise per week. Uh, uh, and it turns out that those within that limit did uh, better than anybody else, and that going in excess of that didn't protect you from mortality. Uh, so that's interesting. I don't know. 300 minutes. Let's see. I do I do about 300. Yeah. Yeah, I do about. Let me see. I do 60 minutes at least 60 minutes every day for 7 days. So 60 times seven is, yeah, so I'm in that higher range, I guess. But they're saying that the benefit is in the 750 to 75 to 150 rather than in the excess of 300. But as you can see, this is a study that was done outside of the United States, and whether it's relative to people like us remains to be seen. Any thoughts about it, Darryl? About uh, the fact that excessive exercise is not beneficial?
Uh, yeah, I tend to agree with that, especially for seniors.
Okay, thank you very much. Any other thoughts or comments about it? Be interesting to see some other articles like that. Um, this is an article that just talks about the fact that we have so much uh, uh, STI, which of course means sexually transmitted infections, and that all women with vaginitis should be tested for it because we have so many of the sexually transmitted infections. And so every time people have vaginitis, they think it might be something else, but it could be an STI. And this physician is suggesting that thinking it's something else results in misdiagnosis. That if you have vaginitis, uh, and it talks about how uncomfortable it is and how with everybody who has vaginitis that STI should be tested for. That's one of the take-home messages. And apparently they are finding out that 1 in 5 people who have vaginitis also have STI. So they're saying when they come in with that they that this is something that should be considered as a possibility in the diagnosis. Darryl.
Yeah, sexually STI is increasing with the elderly. Rates of syphilis, gonorrhea, chlamydia have more than doubled among those 55 or older in the past 10 years. So you have, for those aged 65 or older, chlamydia rates have more than tripled. Gonorrhea cases increased sixfold, and syphilis cases soared in numbers nearly tenfold. So, the conventional wisdom or the thought with the elderly is that they fool around with other elderly, that it's safer, but apparently not. It's a whole lot more dangerous, and there might be, I hate to think about all the swinging that's going on in some of the assisted living homes.
Mm.
uh, Thank you for sharing, Darryl.
Yes. So, word of caution to us in our demographic: if you're going to play in the rain, make sure you wear a raincoat.
Thank you, Darryl. Okay, well.
Or better yet, get married and stay married and don't fool around.
Okay. Any other comments or thoughts about that? Okay. Well, let's go to the next one. The RSV vaccine, which was recommended for people over 65 first. Now they're lowering that age to 50. Um, it's interesting that this happened because uh, we were initially thinking it was for those 65 and older, but now they are finding out that people younger are getting it as well. So you young folks on the call who are under 65 get the RSV. As older folks have gotten it already. So RSV is something that kills a lot of people, particularly elderly. And the thought was that 60 to 75 was the age that it was more lethal, but they're finding out that people who are 50 equally susceptible to it. Darryl?
Yeah, can RSV turn into pneumonia?
Yeah. Mhm. Lethal pneumonia. Um, by the way, Dr. Perez is away taking care of her new grandson in California. So she probably won't be back for a while.
My
She's,
grandson and I are listening to you. He's sleeping
oh
on
my
my
goodness.
chest.
Oh,
I
I
was
didn't
late
think
because it was a 3 hour, but we're training him up in the way he should go.
How about that? Oh my God. I thought you'd be out there in California and it'd be too early for you to be listening to us. But anyway, welcome. You and your
He,
grandson.
he says, thank you.
Okay. What a surprise. Okay. This is an article on ADHD medications and cardiovascular effects, and the fact that these drugs are not bad for the cardiovascular system. We know that nowadays you have a diagnosis of ADHD, they put you on medicine. In the old days, they didn't put you on anything. Now they put you on medicine. And so the question is, well, are these medicines good for the cardiovascular system or bad for the cardiovascular system? And so the studies have now identified that there's no negative impact on the cardiovascular system. And so it does appear to be safe to take these ADHD treatments for your pediatric patients. Dr. Perez, you have any comment about that?
I'm glad that it doesn't have the negative effect because it is very, very beneficial. And having many people, including me, had the diagnosis well into adulthood. Now, I would have been a superstar like Dr. Callender had that diagnosis been made when I was younger.
Well, my wife said that I had ADHD, but anyway, I never was treated for it. So, uh, you
If
know,
you were, I don't know what we would do. My gosh.
uh, well, and our young kids coming up, if they have a hint of that, of course, we have a lot of people in medical school who have it and don't get it diagnosed until they don't do well on exams and they have tested and they find out they have some kind of learning disabilities that were undiagnosed. So when your children and grandchildren are coming up, it is something that is a lot more common now than it used to be. Probably it's not more common, it's more commonly diagnosed than it used to be. But it's good to hear that these medications are not dangerous to the cardiovascular system. John Buchanan.
Yes, Dr. Callender. Um, is what is ADHD? I hear about it all the time and really don't know what it is. And is it related at all to dyslexia?
Dr. Perez, you want to address that?
It can be, but it isn't. You can have um, attention deficit disorder. Some some people are hyperactive and some are not. I'm not, but I have attention. I say attention um, directed differently. So dyslexia can occur with it, but it is very different. Um, Dyslexia is specifically where you reverse letters and words, whereas ADHD is where your attention, you have flight of ideas. It's very difficult to focus on a specific thought. Um, so they're different, but they can be found clustered, if you follow me. Does that answer your question?
Yes, ma'am. Thank you very much.
Yeah, thank you for being there, Dr. Perez. I thought we lost you for a while. So good to have you back. Darryl?
Stats from the CDC Center of Disease Control say that non-Hispanic black children were more likely than non-Hispanic whites or Hispanics to be diagnosed with ADHD by black children 16.9, white children 14.7, and Hispanic children 11.9.
Okay, I think this may be the last article. It's 10:30. And thank you all for joining us today. Tomorrow is my wife's celebration of life at Asbury United Medical Center. I'm sorry, Methodist, Asbury United Methodist Center Church. 10 is visitation and 11 o'clock is the program.
Mm.
Thank you
our
for your
hearts will
prayers.
be with you, though we will not
Thank you.
be there.
Thank you for your prayers, and it's helping me make it through the day. And
Yeah.
thank God for the 56 years I had with my wife. So I'm very grateful that God's blessed.
Yes.
Absolutely. Yes.
Yes.
Okay.
Yes,
God willing, see you next week.
Dr. Callender, can I ask you a question?
Yes.
As you know, my sister Betty's not on the program this morning, but she wanted me to ask you, where is the service being streamed? Because well, I'm not on any. She said TikTok or YouTube or something. I'm not on any of those platforms, so I don't have a clue what you was talking about.
It's YouTube and Asbury United Methodist Church.
Very United Methodist Church and YouTube.
Yeah. Mhm.
Okay, I'll let her know. And again, my thoughts and prayers are with you.
Thank you so much. I appreciate it, Elizabeth.
Yes.
Okay.
All of us are praying
Thank
for
you.
you.
Thank you. And your
Yes.
prayers are helping very much. So keep it up.
See
And
you.
You're
see,
bearing it very well, Doctor.
thank you.
Mhm.
So see you next week.
All
All
right.
right.
Thank you so much.
Bye-bye.
Thank you.